Hey guys, Carmen here. I am a myofunctional therapist with a large global practice, so I do teletherapy with people all around the world when it comes to myofunctional therapy. Today we are going to be talking about an exciting topic called Don't Raise Ugly Kids. I have a PowerPoint that I'm going to use right alongside with us, so let me get that going. I'm trying to be all fancy and we'll see if it works for me. All right. So, like I said, we are going to be talking about don't raise ugly kids. But first, I'm in Nashville. I am attending the Collaboration Cures conference. And as an airway advocate for the Foundation of Airway Health, I love the work of the AAPMD. So, this is the American Academy of Physiological Medicine and Dentistry. Basically, this group is a group of professionals, doctors and dentists, that have banded together to focus on airway first, which is so important as you're going to learn here shortly. This group makes doctors and dentists work together, and dentists pledge not to do things like pull teeth to create space in the mouth, that kind of stuff. So I always tell parents, if you're inquiring with your doctor about their knowledge or if they support the importance of airway, that kind of stuff, ask your doctor if he or she is a member. That's going to be really helpful. Now, one thing I wanted to tell you is that later this fall, I am going to be teaching a free class of the same title, so Don't Raise Ugly Kids. If you are a parent of a child who has concerns, you're going to want to make sure that you get notification about this class. So this class will be used to launch our new programs that are aimed at teaching parents how to implement myofunctional education into fun family activities. So the free classes are going to be talking about 6 areas that you should really know about your child's facial development. Those 6 areas are going to be airway awareness, tongue tie, tongue thrust, mouth breathing, early ortho visits, and correct mouth posture. But today I'm going to talk about 3 of those topics. The first one being airway awareness. So having an eye for airway concern with your kiddo can be huge. Oh goodness, we're just going forward here. Let me back up. Noticing if there's a concern with your kiddo is very important when it comes to airway. So this can be a big advantage for your child. So some of the symptoms of your child having an airway concern are snoring, mouth breathing, poor attention span. Does your kiddo take a medicine or have they been labeled as having a concern with ADHD or ADD? Does your child grind? This is a concern. This is like your body's 911 crisis call. And when your dentist tells you that they're going to grow out of it, not so much. That's not great advice. Does your kiddo have behavioral issues, bedwetting, daytime sleepiness? What about sleepwalking, night terrors? Are they restless at night? Is this like sleeping with a gymnast? Do they sleep in funny positions? Do they pause their breathing? So a great question is, how does this relate to my child's craniofacial development? So in a nutshell, when a child's face does not develop properly, the airway can be compromised as well. So ideally, the maxilla, which is the upper jaw, this is going to develop adequately forward. When that happens, the mandible will follow suit and it's going to grow forward as well, kind of like a lid on a box. And when that mandible grows forward, it's going to bring the tongue and the soft tissues with it. And when that happens, then it increases the space of the airway back there. So airway is king. I get lots and lots of parents who they just want to jump right into dealing with a frenectomy. I don't want them to do that. I want to focus on the airway first. And this means if there's a tonsil issue, if there's a space issue, if there's a breathing issue, we need to address those things first. So let's talk about that tongue tie. That's really the next step, and it's super important. Now, if your kiddo had latching issues, was colicky, gassy, Didn't gain weight, failure to thrive, speech issues. Was your child picky, not sleeping well? What about snoring? Does your child just have poor tongue function? I mean, it doesn't take a rocket scientist to say, hey, something's wrong. What about rapid eating behaviors? Open mouth resting posture, grinding. As an infant, did your child eat all the time? So a lot of mamas will say, well, my kid, no, oh, my kid nursed great, but he or she would nurse for 10 minutes and fall asleep, and 10 minutes and fall asleep. That's a child that's exhausted from nursing. So it's a really difficult job with a tongue tie. And so those kiddos tend to eat a little bit and sleep, eat a little bit and sleep. So that's one of the big red flags. The other thing is digestive issues. As an adult, adults, can say, yeah, I'm always gassy, or I always have a stomach ache, that kind of stuff. But kiddos don't know. They just think that this is their norm. So they might complain about a stomach ache. But very often when I work with kiddos who have a tongue tie, they have rapid eating behaviors. They don't chew their food. Some of them just barely chew it so that they can swallow it. The other thing is, if they're not chewing it, they can have digestive issues from that. They might be swallowing air from their swallow. So how does this relate to your child's craniofacial development? So there are a lot of long-term consequences related to a tie, but as far as craniofacial development, if the tongue is not up, it cannot provide the support that it needs for the developing maxilla. So when that tongue is up, it helps spread the maxilla out so it gets wider and it brings the ceiling of the mouth down. A narrow maxilla can lead to a narrow face, small nasal passages, small mandible, airway compromise. When the tongue is a physical barrier like a tie, it's impossible for the face to develop properly. It just can't happen. So if your doctor looks in the mouth and is only worried about the tip of the tongue, this part of it, that's not good. This is the most important part. Yes, this is involved in speech and licking ice cream cones, that kind of stuff. But the posterior blade of the tongue, that's where I'm so focused, because that's the swallowing mechanics. And that kiddo who can't swallow at 5, eventually becomes an 80-year-old who has difficulty also. So if you have a doctor who is only focused on the tip of the tongue, then I say get a second, third, fourth opinion. So let me just share with you Andrew here. And of course, I've changed the name. So if you look at these pictures, this case just always makes me so sad, because Andrew was a hygiene patient of mine when he was 11. As you can see by this slide, he has an obvious tie. That's low-hanging fruit, you guys. Andrew had been going to the dentist religiously every 6 months since he was 2 years old. So can you imagine his mom's frustration when I brought her back to my operatory to talk about his tie? The whole family called it his butt tongue. So they knew something was different, but nobody had ever told them that it was concern. Now, this was the first time that I had seen Andrew, but what about all the other hygienists? What about the same dentist that he had been seeing, by his age, 16, 17, 18 times in the same office, and nobody ever mentioned this? This is 100% unacceptable. And so this is really why I spend so much time teaching the importance of myofunctional impairment identification, helping dentists and hygienists learn why they need to be catching this stuff, because this low-hanging fruit should not be slipping by. All right, and then I want to talk about mouth breathing prevention. If you have a kiddo who is mouth breathing, they're getting less oxygen, the nose doesn't get to do its job to moisturize the air and filter it and clean it. Your child who's mouth breathing is constantly running from that saber-toothed tiger. So when you talk about parasympathetic and sympathetic nervous systems, your kid is always in freak out mode. And nobody knows that, except, on the inside versus what's going on the outside. There's anxiety, there's poor digestion, large tonsils and adenoids. There's no nitric oxide, which helps the uptake of oxygen into the lungs. When somebody's nasal breathing, we see increased congestion, and that's just the vicious cycle of mouth breathing. If you haven't heard me talk about that, go to my blog and watch that video. There's dry mouth, there's decay, there's a lot of things going on. So, how does this relate to your child's craniofacial development? Mouth breathing leads to a long, narrow face. I always share with you guys, look at my face. You can see that it's long and narrow. I have this angled jawline. You can look at my facial structure and say, yep, Carmen was a mouth breather, and I was. When nasal breathing is the predominant way of breathing, it helps that forward expansion of the face. So children who mouth breathe have less energy, they sleep poorly, they may have poor behavior in school or poor performance at school. They might grow slower or have crowded teeth and large tonsils, just to name a few. This is super important. And so when somebody is mouth breathing, the earliest correction is better. So, when parents say, what can I do? Be talking about this stuff with your kids, seeking out ways to help correct that with them. Like I said, I will be teaching a free webinar coming up pretty soon called Don't Raise Ugly Kids. And I'm going to be going over the 6 things that you should know about your child's craniofacial development. So first of all, if you are not on my mailing list, I encourage you to get on the list so that you will get a personal invitation. You can go to the bottom of any one of my blogs, and if you download like the quick assessment, that kind of stuff, just make sure that you click yes when it asks you if you want to be added to the mailing list, because I'm happy to give you the free whatever it is that you're after. But if you click no, you're never going to get notification, which means you're going to miss out on learning about our new program. So I'm so excited about Frenectomy Freedom. This program will be launching soon, as well as Mommy Myo and me. So if you are on that list, make sure you're on the list so that you get the invitation. You guys, I will be back next week live, yay. And I'll be sharing a lot of stuff that I learned at the Airway Convention. So with that said, have a beautiful time. Thank you for being part of my community. I'm grateful for each and every one of you. I'll see you next week. Bye for now.